It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock on You. I'm your host, Bob Roth, and it must be Friday, and indeed it is. We're coming at you live from the Scottsdale Air Park Money Radio Studios, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. It's hard to believe we're here at the very beginning of April. It's Friday, April 7th. Good Friday. Happy Good Friday to everyone out there. And if this is your first time tuning into our show is about how our older adult population can live a healthier, happier life. And that's not by listening to me, it's by listening to these extraordinary guests that I get to bring into the show. So today is no different. I have two extraordinary guests. These are guests of mine that are from the industry that I am in. And many of you know this. Cypress Home Care Solutions is an in-home care service provider. We provide in-home care supportive services for those that are looking to remain as independent as possible and live out their days in their home. Both these folks have been in the industry a long time, and they are with this incredible company called Access. So without further ado, I want to introduce to you, our listeners, Keri Lamont, who's the Vice President of Client Experience, and Chris Taylor, Senior VP of Channel Partnerships with Access. Welcome to Health Futures, guys.
Thanks, Bob. It's great to be here.
Yeah, thank you.
It's good to have you here. And Keri, you and I talked about this before the show. You are native here, and we always see each other at conferences, and it's really nice to see you here in our backyard together.
So, yeah, definitely, so to speak, the proverbial backyard. It's exciting to be here and to be talking with you today about some of these important topics.
Well, it is, and let's kick it off and really talk about Access, because you guys, I don't know how long the company's been around, but you guys have really taken this industry by storm. I mean, 10 years ago, I don't think Access was what it is today. And John Alajade has really built a great organization. So I'm looking at you, Chris. So if we're going to tee this off, I would love for you to tell us a little bit about Access and John Alajade's vision and where you guys are today and where you guys are going.
No, that's great. Thanks for the opportunity. Over 10 years ago, John Alajade was working as a consultant, working with agencies that were focused on and providing services to patients in the home. And one of the things you continue to keep hearing is, how are we going to continue to do this? How can we do this better? And at that point, John realized that creating a technology, a solution, a platform to be able to bring these benefits to these individuals, these organizations, not only across the country but internationally. This issue is there. How do we take care of people where they want to live? Right. They want to live in the home, and so he started this adventure, and he focused on home health first. And Access since then has created 4 actually unique platforms, with a home health platform, a care and home care, the industry that you work with and with Cypress, also a hospice specific platform. And the most recent was we realized that the palliative care industry is very important, and it is needing those tools. So we started from the ground up, and unique, really the only one out in our industry that looked at that industry and figure out what tools, what benefits we could bring, and built a palliative care specific. The great thing is all of our platforms have been viewed by several of the accreditation organizations like CHAP or like ACHC, and given us both a verification and certification that these tools are what the agencies need to bring out these benefits.
Yeah, I find it fascinating, especially with the building of the platform for the palliative care side of our business. And, we all have been in the business a long time, and palliative care is relatively new. And for us, and we've talked about it here on our show, is about how do we deliver care in the home and making people comfortable. So, I applaud John and Access for doing that. That's exciting.
Yeah, it is really. One of our goals, and I think the industry needs, is that education. I look back at hospice 10 years ago, and the individuals that understood the benefits as an individual to even ask for or to be involved in hospice was so different than it is today. And I see palliative kind of following that same path, that it's another wonderful service line that our loved ones, one day soon me, will be able to be receiving that care in the home like I would like.
Well, there was some really big news that broke last week or the week before, and that was the news that NAC and HPCO broke, and that is, these are two trade organizations for our listeners that are really in the home health and hospice trade, and there's a group called NORC that is part of the University of Chicago, and they had done a study showing that hospice care contributed to $3.5 billion. That's B with a B, $1 billion in Medicare savings in 2019. We all knew that, but we never had the data to be able to support that. And let's talk about data. I mean, isn't that what Access does? You guys are really collecting a lot of this data.
Yeah, and in fact, one of the things we love doing is also not only ourselves, but making sure we partner with other organizations. In fact, this past year, at the end of 2022, we worked with one of the great consulting firm, Symmetry, to do an annual analysis and asked the providers and those in our industry, what are your biggest struggles? What are your biggest concerns? What is facing the industry today? And what can we do to help provide technology, tools, resources, and all of us learning from each other on what to approach? And so we took that data, and we've had it, and now we've been able to present it out to individuals and with some learning tools and such, because that's what it's all about. It takes a huge village, and all of us are part of it.
Oh, no doubt. And listen, we can't just do it with the data. The data gives us the facts, but it gives us the opportunity to act on what we're learning. I mean, let's face it. I mean, we're not in a transactional world. We're in a relational world when we're talking about caring for older adults. And we need data to be able to make really, really, intelligent and good decisions. No,
agreed.
Chris, thank you for giving us the overview of Access and what you guys are doing. And Keri, Lamont, you and I have known each other for a number of years, and you've been over at Access for a number of years now too. And really, I read off your title, VP of Client Experience. Can you do a deeper dive into that and tell me a little bit about what you're doing over at Access?
Well, I think if you think about that's a loaded question. That's a good question.
That's okay. I've got lots of questions.
And it's really important because when I think about the vision for our organization to be the world's best, the global to healthcare technology company, most admired for its people, partnerships, and solutions. The word people is intentionally listed first in that vision. And, we're a tech company.
Right.
But ultimately, we're in the business of taking care of people, right? So that's a really important intentionality in our vision. And when we think about the people that run agencies that are using our solutions, that's who we're serving so that they can then serve their patients and clients in a more meaningful and actionable and efficient and quality-focused manner. So when I reflect back on that vision and I think about how does that come to life for me and the people in our organization, in client experience, it's about creating an experience and leading with partnership and relationship with our agency customers. That comes to life in a lot of ways. It's just kind of building off what you just said, the data, right? The data that we can know about our clients helps us inform the kind of conversations that we can have to help them improve their business. It's sometimes teaching a clinical operator how to be a little bit more of a business person and look into their agency and figure out how to fine-tune processes or workflows that will yield to better outcomes, better patient satisfaction. And in some cases, we have to teach the clinical operator how to think like a business person and look at margins so that they can be here for many, many more years to care for more and more people. I've been on the provider side of the business before and came to Access because I feel strongly that tech is the way forward for us to be able to help this industry survive.
Yeah, I couldn't agree with you more. Let's remember the old adage, right? Technology makes it possible, but it's people that make it happen. And I love the fact that Access has people named number one.
Yep.
Well, James has given me the sign. We're down one segment. We got 3 more to go. I've got Access in the house. I got Chris Taylor, Keri Lamont. We're down one. We got 3 more to go. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. And if you're just tuning in, we're in our second segment here, and I've got Access here in the house. They are a technology company in the healthcare vertical. I've got Chris Taylor, who's the Senior VP of Channel Partnerships, and I've got Keri Lamont, who's the VP of Client Experience. If you missed that first segment, go up to our website at cypresshomecare.com. Click on the media button just below its radio show. You'll catch this one and many, many more. So when we left off the first segment, we were talking about what makes Access so great and really keeping people forefront in mind in the delivery of the technology, these platforms that Chris so eloquently talked about in the first segment. So, you know, one of the things that has always enamored me about Access and what you guys do is not only the work that you're doing in our space, in the healthcare vertical, and we'll talk more about that in this segment and many more, but, you know, I love the giving back, and you guys are doing a lot of that. And, there's a great old adage that I subscribe to, and it was, gosh, I'm drawing a blank on it right now, but I'll think of it in a second. But the adage goes like this. It is, you make a living out of what you make. You make a life out of what you give. Winston Churchill said that. Awesome. And I love the fact that John and Access are giving a lot back. So Chris, Keri, share with us some of the stuff that you guys are doing.
Perfect. Yeah, I mean, one of our mantras, we what we call the Access Way. It's kind of a living document that helps. And one of the main sections is that being part of a community, and we do feel like we're part of not only the care and home community, but the overall global community of life and people. As Keri was talking about, we have a focus on giving, the piece that you just mentioned, back to that community, whether it be through charitable organizations that we sponsor or provide to. I know one of my favorite events is around Thanksgiving. I try to make a trip to Dallas. Meanie's Pantry is a great organization that provides food to those in the area that don't allow it. And we take a team from Access there to pack hundreds and hundreds of meals and give donations for them to provide that. And it's just a fun event to where it makes you feel full as you stand shoulder to shoulder with your other, as we call them, accessians, to be able to do that. And we don't only do that from that standpoint, but also on the public policy standpoint. Right now, we just had a contingency in Washington, D.C. We had what we called March on Washington. And so we had accessians there being able to go in the corridors of Congress to help promote those things. John Olajide is a really an industry leader in that sense of providing opportunities in his home to have, some of the senators, Senator Stabenow and others, to help promote, whether it be in the hospice space or the home health space and the home care space, working with all of the national organizations and those to be able to support them in this community drive. We have a saying, an adage, as you just mentioned, where the rising tide rises all boats, and really that's our focus on the community, whether it be shoulder to shoulder packing meals at Meanie's Pantry, or whether it be on Capitol Hill. And in fact, Access this past year, now over a year, we created our own pack, one of the only ones that I know of in the industry on a vendor side.
Yeah, I've never heard of that before. You guys have your own pack.
Yeah.
Wow.
Because we
for our listeners, we use a lot of acronyms. That's a political action committee. So yeah, you have people making contributions to this fund.
Yes.
So you guys can get forefront in front of our lawmakers.
Yes.
And make sure our voices are being heard.
Yes, and we have the number. I mean, hundreds of individuals at Access that see that same feeling of community and the importance in people and providing that services to really at the end of the day, how do we better take care of people in their home? And that's really the driver. And the people that work for Access and Access as a whole really puts that focus. And that's why we went through the efforts to create this pack, so we could go, side by side, shoulder by shoulder with like the NACs and the NHPCOs and the HCOAs of the world to go to Washington and push that advocacy of why we need to be able to do that. We got to do so much more because that need is just growing. The population and that need is increasing at an exponential rate.
You're so right. And, for our listeners, we had a chance to visit just prior to coming on the show together. We had a really lovely breakfast together. So I really enjoyed spending some time with you and reminiscing and going down memory lane. And, we talked about an individual that was the head of the National Association of Home Care and Hospice, and that was Valhalla Medeiros, who really left an indelible footprint and really, molded me and so many others in this space. And, talk about advocacy. That was something that was really big and near to his heart. And, one of the things that he said was that one of the last Civil Rights Act was to be able to ensure that the right to be cared for in your home, that every American has that right. And our goal should be to help the frail, disabled, and dying Americans stay and live as independently as they can in their home. And, the advocacy is so important. And, our older adult population is something that is oftentimes ignored. And we all know about, our current administration having this Build Back Better plan that had $400 billion in it for home and community-based service work. And then when they pared it back, they had $150 billion in that. And we all know that Build Back Better didn't happen. So none of this money did come back and trickle back into caring for older adults. So I love the fact that you guys have a PAC. I love the fact that you guys are engaged. I love the fact that you guys marched on Washington, because providers are doing this every day. And Keri knows this, having been on the provider side. I mean, we're always out there doing that, but we need our partners. We need companies like Access to be hand in hand with us and helping us advocate for the elderly and infirmed. So thank you for that work that you're doing.
Yeah, well, we look forward, and we will continue to push and try to pull others up with us.
Well, I think today or tomorrow, Home Care Association of America is doing it. So it was nice to see that both of them, the big trade organizations, are out there on Washington advocating. So, as we get ready to wind down the second segment here, the value of partnerships. Would love for you guys to talk a little bit about that, because that's exactly what advocacy is. It's about partnerships. So please, if you would, take advantage of that.
Luckily, with my title being the over-channel partners, I'd love to take that. And in fact, if you go back to what Keri said, our focus on people, partnerships, and then solutions. So even we put partnerships before solutions, because we know that's the way that 1 + 1 = 7 is really our focus. And we have amazing partners both on a technology side, our interoperability partners, and then we also have our channel partners that stand beside us. And again, we've built this spider web network. Instead of just a hub and spoke, now we've also connecting each of our partners with them, with partners. So it's a great opportunity for us to do, and we cover all different areas from technology to help efficiencies come, but then also thought leadership, organizations that can really bring technology into the home to be able to bring that need of how can we get one resource, a provider, to be able to take care of more people, and be able to get that times 10, times 20 benefit by putting technology in the home with sensors, and some of our partners like Seniors Home Services or others that bring those tools to be able to bring benefit. So we really focus on partners.
And do they bolt onto your platform?
So yeah, we have some great partners that do bolt on in the hospice space with PBMs and those type of things, with Word documentation and all of that. So we have several different partners that actually bolt on and make it just that much. It's seamless almost, where we can work, and we really have an ecosystem. That's our goal, is to build an ecosystem where we're that centerpiece, but then allow others. We know we don't do everything, focus on everything. So let's bring in partners that do, bolt them onto the product, and then bring those benefits to the end users.
Did you want to say something?
I was just going to explain what a PBM was, because that was another one of those healthcare acronyms. So pharmacy benefit manager.
There
right?
you go.
So helping to make sure that our hospice clients can make the most of their medications.
And the document workflow stuff is, I
both
know that's a
Worldview and
bolt-on.
Procura, they are great partners of ours.
Well, you hear the music. Can't believe it's almost halftime here. So we're coming up on halftime here at Health Futures. I've got Access in the house. I've got Chris Taylor, Senior VP of Channel Partnerships. I got Keri Lamont, VP of Client Experience. One half down, another one to go. Stick around. We got a lot more to talk about. We'll be right back. And it's a Good Friday.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and we are in our second half here. If you were just tuning in, I've got Access here in the studio with me, and Access is AXXESS. If you want to learn more about them, you want to go to access.com.
Exactly.
And you can learn a lot more about them. I've got Chris Taylor here in the studio with me. He's a Senior VP of Channel Partnerships. And I got Keri Lamont, VP of Client Experience. If you missed that first half, go up to our website at cypresshomecare.com. Click on the media button just below its radio show. You'll catch this and many, many more. So, one of the things I often talk about is that, we have to embrace the adage of high tech on our back end, but we have to remain high touch on the front end. That's really imperative in the home care business, because we're in the people business, and that is the number one right behind Access, people. We learned that in that first segment. So I really want to talk about here in the second or third segment, if you would, I want to talk about the rise of innovation and really how you guys are leading that. And we talked about in the second segment, even with the partnerships you have where you can plug and play them into your platform and make it seamless to the user. So please share with us, where is Access in the rise of innovation?
That's a great question. I appreciate it, because there's so many. I mean, we'll probably only be able to hit on a couple in this third segment, but again, as we look at the industry as a whole and where the need is, and then the need is being able to have more educated, easy paths for individuals that maybe left. We had a lot of nurses and individuals that left the industry during COVID, and we're going to retire. But now they're realizing that, I'd like to come back into the industry and get more educated. And what we've realized is that if we can help be that thought leader in the industry and help educate those, some may be in the ambulatory space, working in doctor's offices or in the hospital, but to educate them on the benefits of actually being in the care and home industry, working for a home care organization like yours, or in hospice or home health. And so we created an entire learning management system platform specifically to give education to the industry. There's a wonderful system set up that is accredited, so there's CEUs even available.
Nice.
For those clinicians that live in states that require CEUs, they can get them through our system. It also has different platforms and question sets and for operational, clinical, financial. So for an entire organization, it's a system that can be put into place to help with easy onboarding, to help with continuing education, to help just the overall industry be able to, again, rise that tide to raise all ships. So the Access Certification and Training Program has been released. A lot of times you'll see on LinkedIn or those where we have badges, every Accessian is required to be certified in all platforms, all areas. Whether you're the custodian or John Alajade, you're required to do it. And so I proudly, if I had my blazer on, you'd see this platinum pin that says that I've passed all of those certifications. And we want to push that out to the industry to help rise that whole innovation through easy education, being that thought leader, and to doing that. And so that's one of the more recent ones we've pushed out to bring that innovation to the industry.
I like hearing
and
that.
you don't have to be an Access client to use it. So we
please
open
tell
it
us
up.
more.
Yeah, we
Yeah,
open
yeah.
that platform up to agencies and people who may have a desire to want to become part of the care at home movement to get educated about industry-specific things as well as how to use our solutions. So, we have this central theme that keeps popping up in these segments, Bob, but it's about people, right? And so, Chris, you were talking about the workforce shift that occurred during COVID, and now we have new folks that are wanting to enter this space and need to get the skills and the education and the competence to become part of care at home. Access training and certification is a pathway for that. For agencies that are using Access already, that have employees that maybe were at one level of a job role, it's also a great way for them to build bench and work on retention of valuable staff that have sort of that core knowledge set, but maybe a caregiver wants to become a scheduling manager, or a field nurse wants to become a clinical manager. So this training and education platform is an extension of what the home health care and home care and hospice providers can extend to their employees to further develop them and keep them in the industry, so that we don't have this migration of people out of care at home.
You come to us, Keri, and you come to us and see this industry through a different lens. You see it through a different lens because you've been on the provider side, and you also are the recipient of care as well.
I have 3 lenses I look through.
No, you receive care.
Trifecta.
You receive care. You deliver care. We're a provider, and you are now working,
consumer essentially, right?
Exactly.
Yeah.
So I'd love for you to just share what does that mean to you.
Well, I feel like the crossroads where all those things kind of come together is kind of why I'm at Access, because we're not just a technology provider or vendor, for lack of a better word. We see ourselves as sort of a vehicle to empower the future of care at home, connecting the consumer, patient, client, whatever word you want to use to describe it, to the tool sets that are out there that are either available through a provider agency. There's the tech, there's the consumer that's going to benefit from it, and then the people that are kind of
connecting it all,
right?
The
agencies for the providers, I guess we call them.
Yeah.
And I sit in each one of those corners of that triangle every day, right? So it's just it makes me feel like I've found home. And that you can make a difference. I often joke that I still don't know what I want to be when I grow up, but I think I'm closer to having arrived there than I've ever been. So as a parent of someone that receives care at home multiple times a week, it pains me when I see these caregivers coming in and they have their spiral notebook and they're taking notes, and then they go out and pull up their laptop and they're trying to, it's like, just do the documentation while you're with my daughter,
Used to do that in the 90s.
Yeah. Hello, like 90s called, let's, answer the phone.
Exactly.
But that's, so there's this, I have a sense of empowerment.
Right.
To make a difference, and that's the calling that I think Access is answering for many agencies, many providers, and certainly the clients that they serve.
Fuels your passion.
Mm-hmm.
So it's a great segue to really talk about your background, if you don't mind sharing with our listeners. And I'm going to ask you the same question, Chris. So you better think about what you're going to say. Okay.
No worries.
All right. So if you wouldn't mind, indulge us and tell us, Keri, a little bit about your background.
Well. Again, another loaded question. I've been in the care at home space for about 20 years now, and
how could you do that? I mean, you're like 30 years old. So you started when you were 10.
Exactly. Yeah, I'm a child prodigy. Not. I cut my teeth in healthcare as an aspiring nurse. Never made it through the nursing program. But found my way into technology in the acute care space, working support desks and supporting a tech platform in a hospital environment for laboratory radiology and pharmacy. Kind of grew up in that industry or in that company for many years, and got a taste of operations, training, education on using a VT terminal based platform. This is remember when GUI came out? It was ooh, a graphical user interface, woohoo!
Yeah, it was great getting away from DOS.
Right. I had an opportunity to go to a trade show with that organization and got a taste of being on the floor, and seeing what it was like to actually interact with the clients and promote the future of technology. And I thought, this is where I need to be. I need to be on this side of the fence. So made my way over into that arena, eventually found my way to home care and hospice after a personal experience led me to understand care in the home was something that actually existed. I didn't even know it up until that point. Mm-hmm. Started a family, had young children, and saw care at home happen through caregiving for those kids in an intergenerational, interfaith community where my kids were exposed to old people and people of different faiths, and just started to kind of see this world unfold in front of me. And that led me to stay in the home care space on the tech world. Eventually took me to the provider side of the industry, and now I'm back. So
I love it, and I love your story, and I love that you're in this space and you're contributing every single day to helping make client experiences the best they can be. Got a little Marshall Tucker taking us out in the third segment. Chris, I want you to think about what you're going to say about your background for the fourth segment. And what I want to close on the fourth segment too is I want to talk about the future. What do we see for the future in home care, hospice, and palliative care, and using tech platforms like Access? You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. We're down 3 segments. We got one more to go. We got Access in the house. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. If you're just tuning in, we're in our fourth segment here. I've got Access in the house. I've got Chris Taylor. He's the Senior VP of Channel Partnerships, and Keri Lamont, VP of Client Experience. And at the end of the third segment, now, Keri, I can't thank you enough for sharing with us your background, and you could definitely feel your passion and your heart that comes through this. This is a personal thing for you, and I really believe in that, and I believe that's what makes you who you are and the success that you are. So thank you for sharing, Keri. And now I'm going to punt it over to Chris, and big teddy bear over here. I want to hear a little bit about your background and how you got into this space.
Wonderful. Thanks a bunch. I actually started in the healthcare arena in the hospital, and it was really exciting. I was able to stand in on surgeries and watch open hearts and be in the emergency department and be in the trauma centers, and it was really exciting. And one of my friends who worked with me started a company called HomeEd that did remote patient monitoring in the home health space. And he asked me to leave what I was doing to come over to this arena that I had no idea about, and I did it. And what I found out very quickly was that what you just said with Keri's comments of the importance of heart and empathy, because although what I was doing in the hospital was very exciting, it was more transactional. It wasn't that heart and that empathetic approach. As I would go into homes or trailers or any living conditions to set up this equipment, I realized that there's this population that really needs us. And then after spending time in hospice and then having my mother be a hospice patient, I moved from that position. I've always heard where you can hear somebody say, I know about hospice, and then you can hear somebody say, I know hospice. And that transition of watching my own mother be a patient in hospice moved me that point of where I feel like I know hospice. And seeing the needs of those individuals wanted to put me in a place that I could bring benefit, bring that innovation that we just talked about in segment 3, to be able to bring those benefits to these individuals. And that's why for the last 20 years I've been focused on and specializing in looking at companies that create these tools and these benefits to clearly solve those issues.
So she started when she was 10. You started at least when you were 20 then.
yeah, exactly. Maybe 30, but yeah.
No, Chris, I appreciate you giving us that background. And again, I can feel your passion. I mean, especially having your mother experience hospice. And I mean, I never experienced hospice personally. I've been in the business 20 years up till about 2 years ago. And wow, I was just
Life-changing, huh?
Oh, it was life-changing. And my father, who left us in November, made the decision in September of last year when he came out of the hospital still broken. He chose to go on hospice. And the reason why he did that was because he was informed. And we need to keep getting that message out there about, hey, you know, it's not the Grim Reaper.
Right.
It is.
H is for hope.
H
is for hope. You know, it's for hoping for the most of the last days that you have.
Yeah.
And make them
One of
the
my
best
greatest
you can.
mentors, Carla, taught me that many, many, many years ago. Is H is for hope. It's not a bad word.
Not a bad word at all. So let's take a look and look or have an eye out into the future. So, you know, what are you guys seeing in the future of healthcare, specifically home care, hospice, palliative care? You know, technology is happening so fast. I mean, talk about telemedicine. I mean, you know, that was something that CMS, the Centers of Medicare and Medicaid Services, never reimbursed 100%, but they are now, and they saw the value of that during this last pandemic. I think we've seen tech just go really fast. I mean, when I say shooting up to the stars, and I mean, we are moving at a rapid rate. So I would love to get your impressions.
I think
on where
there's
you
a
see
lot of
this.
disruption happening right now, and I think you know, the part of the equation that we're going to continue to face as the folks that are at home that need care continues to escalate and rise in volume is how do we match the caregivers to those people as efficiently as possible and create scale for care at home. One of the other things we could have talked about in segment 3 around innovation is one of our solutions called Access Care. And it's a workforce management solution that if you think about the disruption in the taxi industry, right, Uber, you know, that's like...
Oh, yeah, we all know that.
This is sort of like the Uberization of healthcare, where you can find a nurse that can find a patient to take care of through a technology platform where you got fully screened, vetted, qualified clinicians that have a technology solution that allows them to compliantly document the care, charge for the care, and deliver it in a quick, ready manner to people that are in need, that need it and want it now in their home without the barriers. It will help agencies that use Access Care increase their workforce so that as they continue to receive more referrals for care from other healthcare providers and they need to fill those shifts, they can ebb and flow the capacity of the staff on the shelf, so to speak. The inventory becomes just in time so that people aren't waiting to receive care at home either. So that's something that I'm really excited about in the future is how do we sort of challenge this idea that there's a workforce shortage. I do believe there is to some extent, but there's also a redistribution of workforce to meet the need where the need is right now, and how do we redistribute and make that workforce accessible and available to the recipients, to the consumers, in the most efficient manner. And I think tech is going to be a big part of that. So the Uberization of care at home, that's a big part of the future.
No question. And you talk about the workforce, HCOA, Home Care Association of America, and NAC, National Association of Home Care and Hospice, just published a report 2 days ago, and that was the home care workforce crisis, an industry report and a call to action. So you're right. I mean, we have to solve for this, and tech is a big part of that.
And the consumer movement too. Like, I'm a pickier shopper when I'm looking for care for my loved ones than maybe the consumer of 15 years ago. I want to see the star ratings. I want to know about the caregiver that's coming to my house. Access Care allows us to be able to share that kind of information and use data to really inform the consumer and the provider's decisions.
I got goosebumps. I really do, because when we come off the show, I want to introduce you to somebody that I think will benefit from Access.
Fantastic.
So we have a minute left. You know, Chris, Keri, are there any questions I haven't asked, or is there any lasting thoughts you want to leave our listeners about access and the future of care in the home?
Yeah, I mean, I think if we put a bow around the whole, all 4 segments, we know there's an aging population that's growing at an exponential rate. We know that there's some learning opportunity that needs to be fulfilled. We talked about educating people on palliative care that's not to that level. Even on the when we're talking about hospice, there's a lot of people that don't know the benefits of that. So there's this big education, and then that technology piece to be able to help that workforce. And so we continue to look for that and solutions for that. We have a big Agile conference. It's our first one coming up. It helps us look at these issues to be able to bring people together educate, share technology ideas, create that community that we talked about where it takes that village and rising that tide. And that's our whole goal in April in Dallas at Agile. Perfect.
Thank you, guys.
Yeah, thanks
Keri,
so much
Lamont,
for having us.
Chris Taylor, thank you. Thank you, Access, access.com, AXXESS.com. Make it a great day. Have a great Friday or Good Friday.
Yes.
Happy Easter, happy Passover, and we'll be back next Friday.
That's awesome.
Thank you.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.